welcome. My name is Peter Suzuki, and I'm the publisher of CheckRare. The topic of today's podcast is a rare chronic disease that affects the circulatory system in the lungs and directly affects the ability of the lungs to function. Pulmonary arterial hypertension, or PAH, is characterized by shortness of breath, dizziness, and chest pressure. Today we're talking with Dr. Harrison Farber, a pulmonologist and director of the Pulmonary Embolism Response Team at Tufts Medical Center. Hello, Dr. Farber. Thank you for joining us today and discussing the impact of COVID-19 on pulmonary arterial hypertension patient care. To begin our discussion, what are some of the challenges that PAH patients faced in the beginning of the COVID-19 pandemic?
For the patient with PAH, really almost anybody who's got a chronic disease, they're hunkering down and aren't coming out of the house. Okay, at least during the first couple of waves when it seemed like the COVID virus was much more virulent than the ones that are currently out there. And also the fact that now most people with PAH have been vaccinated, boosted, but at the beginning, they weren't leaving the house and trying to avoid contact and get the disease because they're incredibly high risk because of their underlying pulmonary arterial hypertension.
What are the risks that PAH patients face with COVID-19?
It's not so much that they have lung disease, it's that they have vascular disease. And it turns out that COVID really is a vascular virus. It really affected your vasculature. That's why there was such a high incidence of blood clots. Secondly, if you already are impaired in a respiratory way, okay, because of your PAH, and you get COVID pneumonia, for example, you're already at a point where any perturbation of your respiratory system is going to carry greater weight than in somebody who's got pristine lungs going in. So the risk of getting it is actually higher because these newer variants are much, much more transmissible, seemingly so. Now that may be a function of their transmissibility, but you're more likely to get it. You're less likely to get really sick from it because of the fact that it doesn't appear to be as lethal a virus. You're less likely to get really sick, less likely to end up in a hospital, and less likely to die.
Are there greater risks with COVID-19 infection for certain patient subsets?
It was never considered a comorbid risk like smoking, hypertension, obesity, and likelihood because there are so few people with PAH compared to people who smoke, who have high blood pressure, or who are obese. And also, since the numbers are dramatically small and most of the people isolated very well, there are actually, amazingly, in the first few waves, there are very few PAH patients who actually got COVID.
Has the COVID-19 pandemic affected the healthcare team's ability to correctly and quickly diagnose PAH?
If patients aren't coming out of the house and they're postponing care because they're worried about getting COVID, then obviously the diagnosis of PAH or any disease is going to be delayed. Patients tend to be sicker when they present because they haven't ventured out of the house.
How does being vaccinated impact PAH patients?
There's overwhelming statistical evidence that if you're vaccinated, you're less likely to get infected. If you do get infected, you're less likely to get really sick. You're less likely to end up in a hospital, and you're less likely to die.
How has the pandemic evolved?
Although the pandemic certainly has not gone away, it's changed dramatically. If you go back to 2020, March and April, okay, it was an incredibly virulent strain, the first two. There was no treatment. There was no vaccines. And now at least there's vaccines There's treatment for mild disease. If you get sick and end up in the hospital, it's clear that steroids, remdesivir, things like that actually do help. So it's a different ball game and a different playing field, but it still should not be underestimated.
Thank you, Dr. Farber, for your time and excellent insight into PAH.